Hello. So chapter 3 and 4 are pretty quick, I think. Still, you should know, so I have an idea of it. 3 is talking about the electrodes and the leads. So you have the telebox. It's connected to the wires or leads, and then they're stuck on the skin with electrodes. It goes in certain places, which I'm not gonna get into the leads, where they're supposed to be going. But the hospitals have either like 3 leads or 5 leads that go into the body to monitor. That's where telemetry is. Telemetry is the monitoring of the heart for the patients. Because there's EKG. EKG is the same and not the same. EKG, they run one big test on the heart to see how it's running, and then you get your results, and then they find out if you got something going on with the heart that they need to medicate or whatever. Or telemetry is when they got to study the heart a little bit longer. So that's kind of like what we're going to be doing, right? Telemetry. So some places, if you work at the hospital, it might be live patients there. So you're just gonna be you're going to be monitoring them, and if something goes wrong, then you call the nurse immediately or whatever. But if it's like sometimes they already have it recorded. So what you're gonna do is there are places where they'll send you the information, and then you gotta look at the recordings, and then you gotta kind of clean it off, and then make a report for the doctor. That's what other places do. So you get live patients, or you get recorded information. So depending on where you're gonna go to work at. But yeah, the leads, that's one big problem sometimes, and we'll get into the artifact later. But the leads should be, they should always be clean. So, clean the skin, put the electrodes on the patient, and that's how you get a good picture of the rhythm. So that's what 3 basically is. So 4 is called technical aspects of the EKG. Again, they're talking about the electrodes and the EKG machines on the computers. They should have a chart speed, how fast uh, the rhythms are you going to be seeing. They're usually set at a certain point. If you change it, like to like it's 25, but if you change it to 50, it doubles the width of the waves and the complexes. So it's useful when the patient has a very fast rhythm. Widening out the rhythm, it separates the waves and to help you see the rhythm better. So it gives you that I guess feature, so you can see the rhythm better. You can, I guess, zoom in and zoom out. That's really what it's saying. Gain also is also another type, zoom, like a zoom in, zoom out. So if it's, I don't know, and I don't know why different people have different looking rhythms sometimes. So sometimes the rhythms come out really slow. I mean, small. Sometimes they come out medium. Sometimes they come out big. I don't know why. I don't know. Maybe my brother can tell me something about that if he knows anything. But I don't know. But rhythms have different. So sometimes they come real small. You can turn the gain up, and then you can see it bigger to see exactly. Maybe you can't see a P wave, and so you got to zoom it in, and then you'll be able to see it. So they have those features, but you have to try to remember to put them back um, so you won't get confused that some of the rhythms are coming too big and you don't know why. Artifact is, it says here, unwanted interference or jitter on the EKG tracing. So you get your rhythm, and if the patient's moving, you're gonna get all kind of things. If it's starting to disconnect the electrodes, you're gonna get all kind of things, and then you'll start seeing on the book. I'm sorry, on the machine, that it's starting to get all crazy or whatever, and you don't know what's happening. It's different things. It could be like I said, the electrodes are pretty dirty. It's coming loose. The patient's probably trembling. They probably have too much lotion. It could be a lot of things. So you have to, I think with time you'll be able to see what's artifact, what's fake, and what's real. That's probably one of the hard parts in the beginning, knowing what is fake and what is real. But like I say, you'll pick it up with time. But there are some things to look for to help you decide, yeah, it's probably not real. So you check the other leads. So the a lot of times the rhythms will give you two leads. See, this one is only giving you one lead. See, it's one. Every rhythm has one lead. You're just seeing, but in reality, the I'm trying to find one where it has two. I'll check one right now, but you need to see that it had you get two leads. See, this one has up to four leads. Four leads for this one. Lead 1, 2, 3, and you got two again. And you can see lead 1, it has, you can see for the most part. Number 3, it's looking down, but you can still see that it's marching out. It still has the same beat. Now this one's kind of weird. This is a practice one towards the end of the book. But what I'm trying to show you right now at this time is just that you'll have two leads to work with. So a lot of times if you see something weird happen in the one, you might still see some of it going on the second lead. But if you could still tell that it's marching out on each one, that it's for the most part it's probably artifact, or it probably is something going on at the same time. You'll pick up that skill with time. Supposedly this happens, this dark, like, how it's coming out real dark right there. Supposedly it comes out looking like that if there's a lot of electrical devices nearby. So if it's like that, you might want to tell the PCA or the nurse if they can remove some of some of those devices. They show this one. This one most likely is artifact, because it's just a straight line. When it's a patient, no matter if if they don't have no more heart rate, if they passed away or passing away or something like that, they'll still have like a little bit up and down, because their heart is still having a little bit of a electricity, or not electricity, but they have some impulse or whatever you want to say. It's still kind of happening inside the heart. But this one is fake, because for the most part you're not really gonna see a straight line like that. You might if they leave the patient on telly, but most likely once the patient is pronounced, like if you get a patient that's passed, they'll pronounce them deceased, and then they'll go ahead and take them off. But they gotta, like I said, really make sure that they're deceased, and then they'll take them off. If they're working on them and giving them CPR, you'll probably see something like this. CPR, this is a CPR artifact. I guess each time that they're trying to revive them, you'll see something like this. You will see stuff like this. Like this in the top is calling it a toothbrush tachycardia artifact. The one in the bottom, they're saying it is true. So you see how it kind of seems the same, but since you're going to be looking at the patient, you're going to be looking, and you're going to be seeing for the most part if it's leading up to that. Are you starting to see a lot of and we'll get into it later in the later chapters, if you're starting to see more PVCs or ventricular rhythms, then you'll most likely, because you won't get a real good rhythm and then all of a sudden do this. It doesn't really happen that way. Normally the rhythms lead up to this, and then you'll start to see real pretty rhythm, and then it starts looking with the wide QRSs, and then you'll start seeing something like this in the bottom. You don't normally go from beautiful rhythm to something like this. That doesn't happen. So you're looking at the rhythm, you're seeing the patient, what they're running, and that's how you know. I wrote some notes for the artifact. So you, like I said, you're going to be looking for ectopy or changes in the heart rhythm that is not normal. That's what ectopy means. So you're going to be listening for these words, these little fancy words are going to be coming up when you work with EKG. Like I said, artifact is something that we use a lot because that's something that's not real on the on the rhythms. Ectopy, like I said, changes in the heart rhythm that is not normal. Our job is to report anything that you see that's different, that's something that's going on, and some of the stuff that you're gonna learn. So if the patient has a lot of, for example, PVC, something that we'll cover later. If the patient normally runs that, then you'll tell the nurse. The nurse is the one that covers the rhythms. You'll tell her, you'll ask her if it's okay, how often do you need to check in with them to let them know. Sometimes if they're used to them, the patient that's normal for them, then you don't have to keep calling them. Our job is just to report what we see, you know. Sorry, I keep coughing. Our job is to report what we see, any changes, any ectopy, anything. The nurse's job is to contact the doctor to let them know, the doctor is the one that makes a final call what if they need medication or something for their heart. But for the most part, we are supposed to be the ones to know what to look for like lethal rhythms, the ones that if you don't get to the patient fast enough, they could pass away. So you're supposed to our job is to notify the nurse on time so they can get to the patient and see if they can do anything for the patient, as far as like reviving them or keeping them alive a little longer or something like that. But they want to make sure that you catch it on time because you're the one that's monitoring the patient. So just monitor the patient, see what rhythm they're running, see if anything changes, how often are PVCs or PACs or ventricular runs, or how often is it happening. So like I said, most of the time, and I'm going to keep saying this throughout the whole videos, most of the time you're going to be looking at sinus rhythm. But which is a good heart, right? A good heart rhythm. But you still want to make sure and be ready that when you see some stuff that you need to be able to notify immediately. And what I'm saying, like they might want you to print out, every time that something happens, you need to make sure that you print it out and record that information. They'll let you know all that stuff. But so like I said, sometimes the patient has tremors, or sometimes you don't have control over some of these patients that sometimes they're elderly, they have tremors, so they're every now and then you'll get somewhere you cannot, you don't know how to measure it because it's shaking too much and stuff. As long as the nurse knows, and most of the time the nurse does know, as long as you're both on the same, everybody's on the same page, as long as everybody knows the patient has that, then you just do the best that you can on the measurement of the strip and send it on through. And then, like I said, the nurses are the ones that you normally talk to for serious things, anything that has to do with rhythms. The PCAs are the ones that help the nurses out. They're usually the ones that you call for like battery issues of the telemetry box, battery issues, or maybe replacing the electrodes on the patient so you can get a better view of their rhythms. But that's it for 3 and 4 right now.